Hi, I'm Jim Amos, and this is the Coach's Corner on somatoform illness. Why is this important? About 3/4 of primary care visits are due to somatic symptoms that will be medically unexplained physical symptoms ultimately, cost a lot of money, and patients are very unhappy with their care. Medically unexplained physical symptoms are costly in a number of ways in the patient-physician relationship and the quality of care perceived by the patient, as well as the quality of life. The goals of collaborative care in somatoform illness are not to overdiagnose or underdiagnose the condition, to make sure they get regular care to which they have the right to access, and to identify and treat any comorbid psychiatric illness. This is slide 5, and it has a very simplified, perhaps overly simplified table about the differences between the somatoform illness. Try to use it as a rough guide. Briefly, somatic symptom disorder is a condition in which people are preoccupied with their physical symptoms that are medically unexplained, and it becomes a way of life for them. They can also have comorbid general medical conditions. Conversion disorder is one or more motor or neurological physical symptoms that don't have a medical explanation and it cause a lot of distress. It's worthwhile to listen to the patient for understanding, avoid confronting them early on with the diagnosis, and suggesting that the symptom will probably go away in about as much time as it came on. On slide 9, these are the steps for communicating with somebody about somatoform illness. Validation is probably the key, and spending enough time with the patient, listening to them for understanding is very important. Slide 10 has a list of special cases of somatoform illness. Factitious disorder is about patients lying to doctors about their conditions. Malingering is not a psychiatric problem, it's an accusation. And special cases includes the somatization of depression and anxiety. Factitious disorder and malingering are abnormal illness behaviors that are very difficult to deal with. The key is to help the person give up their abnormal illness behavior in a face-saving way, if at all possible, and to avoid unnecessary confrontation and conflict. Well, that about wraps it up. And remember, as Stephen Covey said, with people, slow is fast and fast is slow. In order to be effective with people, it's better to spend enough time with them and not to try to be efficient. Now get out there.